Hello, and welcome to the second episode of our Fall 2020 Learning to Listen Conversations for Change webinar series. Thank you so much for joining us today. I'm Joshua Sparrow, Executive Director of the Brazelton Touchpoints Center, where you can find webinar series on family engagement, mental health for all of us during COVID-19 times, and many, many others, including more conversations for change. Just go to brazeltontouchpoints.org and click on the webinars tab, and you'll find the list of the many offerings of our upcoming webinars right there. We are so fortunate to have our featured speaker, Mayra Alvarez, with us here today to answer your questions following the premiere, which will start shortly, of the conversation we recorded together before the pandemic hit. So we'll watch our conversations about 30 minutes, and then we'll take the next 20 or 30 minutes to talk together to answer your questions, because the world has changed so much since we first talked back in January. But before we start, here are a few housekeeping and technical details for you. First of all, we've got nearly 1,500 people registered for today's webinar, which is amazing. But if you're having difficulty viewing the webinar in Zoom, you can watch it live on our Facebook page. So just search for the Brazelton Touchpoint Center in Facebook, and then you'll see the live stream video pinned to the top of our page. Now for today's webinar, we once again have Spanish translation provided by our superb interpreter, Maria Jose Gutierrez, who is joining us all the way from Bogota, Colombia, where she's in rainy season. Thank you so much, Maria Jose, for working with us again today. And to access the translation, just click on the interpretation icon in your Zoom controls at the bottom of your screen. Then select Spanish. To mute the English in the background, select Mute Original Audio. La conversación de hoy será en español e inglés. En los controles de su reunión, haga clic en Interpretación. Haga clic en el idioma que le gustaría escuchar. Para escuchar solo el español, haga clic en Silenciar audio original. Today's webinar includes a chat box and a Q&A box. Most of you are probably familiar with those, but please use the chat feature if you have a comment to share or if you need help with a technical issue. And be sure to choose all panelists and attendees if you'd like everyone participating to see your comment. You can choose all panelists if you just need help with a technical issue. If you have a specific question for Myra, please use the Q&A box, and we'll be answering your questions, as I said, at about 3:40 Eastern time, right after the premiere of our conversation, which runs about 35 minutes. Now, tomorrow, you'll receive a thank you email from us with a link to a recording of today's webinar, so you can watch it again and you can share it with others. And you'll also have a link to our feedback survey. You can also access the recording on our YouTube channel and on the brazeltontouchpoints.org website. So please complete the feedback survey so that we can send you your certificate of attendance. And the survey will also be in Spanish. Today, if you have any technical problems, please email Kayla Savelli, and you'll see her email address posted in the chat. Now, before we begin, I want to be sure to thank our sponsor, the fabulous Burke Foundation, sponsor of all of the Learning to Listen Conversation for Change webinars in this series, and to our wonderful Brazelton Touchpoint Center production team, Kayla Savelli, Ashley Gaddis, and Michael Accardi. I also want to thank our friends at Santa Monica Studios, where this conversation was filmed and edited. And of course, I want to thank our expert for the fascinating conversation we're about to watch, and who is joining us today to answer your questions. Thank you so much, Myra Alvarez, for fighting so hard for immigrant families and children, and for all children, for the conversation we're about to see. And thank you for coming back to be with us today. We'll all find out more about Myra in just a moment, so let's get started.
Learning to Listen TV show and podcast series, Conversations for Change, presented by the Brazelton Touchpoint Center, hosted by Joshua Sparrow. Dr. Sparrow is a child psychiatrist at Harvard Medical School the author of 9 parenting books, and is the executive director of the Brazelton Touchpoints Center. The center was founded by T. Barry Brazelton, who was one of the most influential doctors in pediatrics and child development of the 20th century. Conversations for Change, opening your eyes for new voices on parenting. Brought to you by the Burke Foundation.
This is Learning to Listen, Conversations for Change, and I'm Joshua Sparrow from the Brazelton Touchpoint Center. In this episode, we'll be talking with Mayra Alvarez.
Myra Alvarez is the CEO of the Children's Partnership, a nonprofit children's advocacy organization committed to giving every child the resources they need for a bright future. Myra began her career as a policy fellow in the office of then-Senator Barack Obama. Myra combines her decade of experience in healthcare policy and community outreach with her conviction that every child should have the opportunity to pursue their dreams. Myra has served as an accomplished spokesperson on the Affordable Care Act, and in 2014, the Huffington Post named her one of the 40 under 40 Latinos in American politics.
Hi, Myra. Thank you so much for joining us. Let's start by hearing about the Children's Partnership, which you are the president of.
Well, thank you for having me here with you. I appreciate the opportunity to engage in dialogue with you and know that our shared work for children and families will be stronger and more effective because we're aligned in that work together. So the Children's Partnership is a statewide advocacy organization based in California. We focus our advocacy efforts on ensuring that children are first in policymaking, particularly focusing on their health and their well-being. By placing a children's lens on issues of today, we know that we can ensure that policies that are passed and legislation that's enacted will better prioritize the well-being of our children, and in doing so, really prioritize the future of all of us.
So I know that you are a fierce and passionate advocate, but I don't know how that happened. Tell us about you and how you came to care so much to do the work you do.
You know, I think like so many of us, it really comes from our families and ensuring that we reflect the values that we were raised with. And my family is from Mexico. They immigrated to the United States in the late 70s. I was born a few years later, so I was the first in my family to be born in this country. And being raised Mexican American in California was definitely something that you knew was happening. We spoke Spanish at home. Sometimes when I went to school, I didn't have the same school lunches as my friends, but I knew every day that I was deeply loved and that I was deeply taken care of. My mother may not have known what school field trip signs, forms to sign, but she was supporting me and asking me questions about my day and encouraging my attendance. And I think the values of family and community and giving back were something that were instilled in me from the beginning. So when I became a professional and I had the opportunity to work in an area of what I wanted to do with my life, I really thought about health as the direction I wanted to go. And in particular, really thinking about public health. And what public health means is to focus on the health of our communities. So I had the opportunity to work on health policy during part of the Obama administration, specifically on the Affordable Care Act, and working to ensure that everyone has the opportunity to have access to health insurance coverage, because we know that that's such a vital tool for well-being and for success. If we want our parents to work a full work week, if we want our children to pay attention in school, if we want our community members to contribute to society, health is connected to every single one of those goals. On a national level, any of our goals that you can think about, our elected officials talk about, our presidential candidates talk about, health is connected to every single one. And on an individual level, health is fundamental to opportunity. So I knew I wanted to work on health.
So let's talk about health and what happens to children's health when they're growing up in an environment where they are made to feel not only that they and their families are different in some ways, but that they are not welcome.
Absolutely. So I think it's particularly important to emphasize that health is connected to every aspect of childhood development. And as we think about early learning and education at every episode of childhood and as a kid grows up, health is interwoven throughout that. So the reactions of their professionals, of early childhood professionals, the engagement of teachers, the support of mentors and adult models in their life, those interactions are critical to a child's well-being. And we know that for children who are children of color, are low-income children, or may have some other difference, those differences are reflected in the interactions with the adults in their lives, which really puts the responsibility on all of us to ensure that a child's well-being is first and foremost, part of our mindset in interacting with them. I think we all have a role to play when it comes to ensuring that a child's day is that much better. When we're thinking about children's behavior in the classroom or at a park or in a community center, and they're acting out or they're exhibiting behaviors that may not be reflective of a good kid, rather than asking what's wrong with you, how about asking what happened to you, what are you feeling? There are other ways at which we can better understand what a child is going through and provide support and love that enables them to grow up healthy and thrive.
So if the what happened to you is that a parent was detained or deported, or that you're living in fear that that might happen, or you yourself as a child do not have legal status here, what is it that happens to that child, and how, in what you're seeing and hearing, how does that show up in children's behaviors?
So at the Children's Partnership, we really have been exploring how immigration is a children's issue, and in particular is a children's health issue. When I first came on board and after the Obama administration, I thought we were going to be talking about health insurance and staying healthy and becoming empowered consumers of our health care. And I realized that, in being an advocate and talking to community members, our staff, our team, we would go out in the community to talk about health insurance and talk about going to the doctor for your screening and your preventive services. And most of the questions we were getting from families were about immigration. This was about in 2016, 2017. They were asking, is it still safe for my child to enroll in this program? Are we still eligible? Is it safe to go to the doctor? How is my information going to be used? There were all of these questions about immigration policy and how it would impact them. And we were realizing that we were doing a disservice by not talking about immigration in this context if we want to focus on child health. And it really opened the door to being a better ally. Our families that we serve, that we seek to represent, do not live in silos. They do not handle their children's issue one day, their immigration issue the next, their economic issue the next, their food the next. A family does not have the burden to silo themselves off by issue or by child. Neither should we as advocates, neither should we as policymakers, as community leaders. We really must consider the myriad of issues that are impacting families and how they intersect in order to better address children's needs. And immigration is one of those issues. Half of the children in California, half of our 9 million kids have at least one immigrant parent. Nationwide, it's 1 in 4 children are part of an immigrant family. So when we're considering the issue of immigration and we are hearing the words that many of our nation's leaders are saying, the negative words, whether it's calling them names or degrading their experiences, those are words that children hear. When we are seeing the images on televisions of families being separated and children crying and magazine covers and social media coming at our families and our children from every direction, that is impacting a child's understanding, their brain development, and that will manifest itself either in behaviors or in other ways in the classroom and even with young children. That's what research has told us. So we need to understand that it's not necessarily limited to a child who is directly separated from their family, but even children that are being raised in these communities that are part of these families, mixed status families, that may be questioning what's going to happen, that may be worried about it, that may be seeing their parents worried about it. And those interactions also impact negatively their development.
Are there some stories of children and families that you've heard in your work that you could tell us about to help make it clearer just how it hurts?
Yes, absolutely. So one of our partners, the Center on Law and Social Policy, did a study nationwide, had conversations with early childhood providers, spoke to Head Start centers and child care centers to talk about what is the climate of today. Frankly, at the national level, our federal administration has conducted a number of actions that are anti-immigrant and really limit who we believe could be welcome here as a new American in the future. And they had conversations with early childhood providers, and one in particular sticks out in my mind. One child care provider said that there was a young boy of 5 years old who was trying to remember the types of sandwiches that he knows how to make. So remembering that he knew how to make a peanut butter and jelly sandwich or another different kind of sandwich. And when asked, why does it matter the type of sandwiches that you know how to make, he responded, I need to be able to take care of my 3-year-old sister in the event that my parents are deported. 5 years old, having to think about not only taking care of himself and what foods he knows how to make, but taking care of his little sister. These types of stories are not limited to 5-year-olds or 3-year-olds. I mean, it's throughout the entire childhood, continuum that we are impacting our children and frankly, negatively impacting a generation of children that we know we're going to be reliant on in the future. The kids of today, it's so cliche, but children are our future. The kids of today are going to be the adults of tomorrow.
So what do you think will happen when these children are adults, having lived through these experiences of not being welcome, being worried that their mothers and fathers may be taken away from them, and more than not feeling welcome, feeling that they're hated and under attack? What do you picture they'll be like when they're 20 or 30 or 40 in this country?
Well, as we know, and as our Surgeon General here in California reminds us of every day, is that adverse childhood experiences have lifelong impacts when it comes to chronic disease, weight management, overall well-being, right? So we know that they may be more likely to have chronic disease or other illnesses as they grow up. But I think it's important to note that we have an opportunity to intervene. We have an opportunity to not accept that is going to happen to them through training our providers that interact with children, through supporting children in the environments that they are, whether it's schools or child care centers, and ensuring that we are prioritizing their well-being. That is something we can do. And I also really want to give credit to immigrant families themselves. Immigrant families are incredibly resilient. There are a number of protective factors that immigrant families possess that allows many of their children to still grow up healthy and thrive. It's this paradox that you're supposed to be lower income, you're supposed to be an immigrant community, and yet you're having very healthy babies, right? So we know that community connectedness, social cohesion, the values of family, those are important protective factors that we want to ensure are strengthened, are valued, so that the children that are part of these families can grow up healthy and succeed. And I think all of us, as part of society, can learn from that and can ensure that we prioritize those same protective factors in our interactions and in the settings that we know kids are.
Well, so that's what I was wondering about, was what about the rest of society, if there are these elements that are making these children feel threatened, in danger, hated, even with all of the supports they get from their families and their resilience. How do we stand in the shoes of those who start from a place of seeing people who are immigrating as drug dealers or as rapists or as taking jobs away? And do you have any hope about maybe finding some common ground?
I do. I think, it's far easier to listen to the negativity, right? Comments like what you just said should never be repeated, right?
I'm sorry that
no,
I
no,
did.
no, it's okay, it's okay. I say that because it's easy to fall into this rhythm of what we hear and we're just, conversing about it. However, to remind ourselves of the contributions of immigrant communities in a positive way, and there's so many ways to contribute to solutions. Even growing up and recognizing the contributions of immigrant communities, of whose art is hanging in our museums, whose books are we reading about, what historical figures are our children learning about. Unless they see themselves in that, it's going to be difficult to develop into an artist or a doctor or a lawyer. I mean, there are many ways that we can influence this conversation. But part of it is definitely speaking to those positive contributions and recognizing, the many ways that immigrants contributed to this country, built this country. There's a reason why our Statue of Liberty is here and says the words of "Give me your poor, your huddled masses," is because this country was founded on these values of freedom and the right to be able to be free from persecution. And that, the shining light that this country represents continues to be felt throughout the world. And we have slowly started to lose that image. And I think we can gain it back. The majority of people are on our side. The majority of people recognize the contributions of immigrants and the value that they provide, but the noise that is being perpetuated in any way, in any form of social media or communication, drowns it out. And I think as community members, those of us that are citizens, but as community members, we have a responsibility to each other in our humanity to remind ourselves that is fundamentally what we share. I think there's too often in the words that we use, we degrade immigrants and deprive them of their humanity. And I think that was seen over and over again in the policies that the Trump administration put forward. The conditions of the detention camps, the separation of families, the limited, even the limited extracurricular activities that they would allow children to be exposed to in those areas, degrading people of their humanity. And I think when you sit down with someone who may not be on my side, we may not be on the same end of the political spectrum, I think at a fundamental level, we value humanity. And my favorite part about being a child advocate is that all of us, regardless of our political affiliation, want our children to be healthy. We want them to succeed. We want them to meet their full potential. And if we can start there, I believe we can find ways in which we can align effort and find some common ground. I am an optimist. I fully accept that. But I have to be.
Right, you don't have any choice.
Yeah, I have to be.
You don't have any choice.
Absolutely.
We have a question from our audience, and let's see how optimistic they're feeling.
Okay.
Hi, Myra. My question is, how does current immigration policy not only affect individual families and children, but our culture and society as a whole?
That's a great question. I think it's important to, first and foremost, think about kids from a long-term perspective. So many times we think about policy solutions or we think about talking points and it's these quick fixes. And when it comes to kids, you don't see your return on the investment for 20 years, right? So when we're investing in early childhood education and healthy development and prevention and developmental screenings, those are investments that are going to play out far down the road when a child grows into be a teenager, adolescent, a young adult, and finally, a productive adult in society. So it's important to keep that in mind, that the kids of today really are going to be our workforce of tomorrow, when we want to see our future entrepreneurs. For those of us that one day want to have Medicare, they're going to be our Medicare pipeline. For those of us that want to have Social Security as we grow older, it's the children of today that are going to be working and contributing to Social Security that supports people over the long haul. We are connected in every way, shape, or form, as people, as community members, as part of this country. We rely on each other. We have a saying at our organization that a child is a child. We have lost the sense that an immigrant child is not a child, or an LGBTQ child is not a child, or a Black child. I mean, we have to go back to this fundamental principle that a value we share as Americans is to take care of our children. And I think in doing that, we recognize that we're taking care of ourselves, our future. The children of today are intricately connected to the future of all of us tomorrow.
So a child is a child, and as Americans, we take care of all of our children. What do you think happened? How do you think we got to this place where it's even possible for somebody else's child to be taken away from their mother or to be put in a cage? How did we get there?
I think it was a number of different things. I do believe that there are people in the federal administration who do not see all children as ours, and who have fundamentally benefited from white supremacy and historical oppression. And because of that, want to ensure that the status quo continues. And I think across the country, when we see what's happening, I really do have hope. I'm in California, and everyone points to California as, one of the most progressive states. But when you know that immigrant communities are in every state across the country, and that they have jobs, that they are part of communities, that they are contributing, we know that there are people in every pocket of this country that support immigrants. When the Trump administration introduced the public charge regulation, which sought to redefine who was welcome here as an immigrant, and really sought to redefine that it could only be wealthy and white immigrants, you saw a huge backlash. Over 266,000 people commented and said, this is not a reflection of who we are. So it really does give me hope that we will not accept that this administration's commitment to anti-immigrant behaviors and policies will be the norm. We want to rise above that as states, as local communities, in order to reflect our commitment to diversity, our commitment to really this multicultural America that many of us have grown up and loved.
So what about the individual child, the 4-year-old? What are you finding people can say or do to help them get through this period of terrible anxiety about having to make the sandwiches by themselves because their mothers and fathers may not be there to feed them, or their little sisters? What are people saying and doing now to help those kids?
Mm-hmm. I think first and foremost, it is critical that we as individuals and that immigrant communities themselves know their rights, and that we are informed about what is and is not possible. When it comes to immigration enforcement, there are rules that people must follow, right? Whether it is answering the door or allowing someone in without a warrant, there are know your rights trainings that all of us should really take advantage of to ensure that we can be good allies when it comes to our immigrant communities, because it makes a huge difference. And it also makes clear to our immigrant families and their children that they are welcome here, and that you are part of my community. By knowing your rights, you're able to demonstrate that if anything were to happen, obviously. Coupled with that is the training that comes along for many of our child-serving providers. So many of us never really considered immigration as an issue they needed to know. It was, especially if you're not part of an immigrant family directly, and I don't blame you. It wasn't necessarily something you interacted with all the time. But this administration has pretty much put it in the face of everyone to think about, because of the actions that it took to separate families, to degrade immigrants. So really training our child-serving providers, our childcare providers, our teachers, our community center leaders to understand their rights, to know what is and isn't true, to clarify questions around policies, or to be connected to resources in the community that can help them. We don't expect everyone to be an expert at all, but we do want people to know where they can go for more information, accurate information, to help families make the best decisions.
So let's pause again. I think we've got another question from
Great.
our audience.
Sounds good.
From your perspective, what are 3 things we can do tomorrow to improve the lives of children and families that are being harmed by the current immigration policies?
Just 3, okay.
Your top 3.
3 things that we can do. So, building on what we were just talking about, I think first and foremost is to get informed. I think it's very important that in this age of information coming at us from every direction, it's far easier to get lost in the misinformation. So ensuring that we're collecting accurate information about what's happening, whether it's policy changes or how they impact our communities, that's something we want to do. So get informed. The other one is share that information and ensure that we are communicating with our friends, with our relatives, sometimes in very uncomfortable conversations, but also with our community members about what's happening. Here in California, we have the opportunity to create policies that require schools to be safe and welcoming environments for immigrant families. We're hoping that we can do that in early childhood spaces as well, that make it publicly known that this is a safe space for you. Many of our hospitals and clinics are doing the same thing, again, in order to demonstrate and be vocal about the fact that people are welcome here, that immigrants are welcome here. I think that's particularly important. And then I think, part of what all of us have a responsibility to do is to get involved. I think not doing anything is accepting the status quo. And the more we can get involved, whether it is volunteering or making phone calls or marching, raising your voice, we can build the public will that is necessary to demand different and to take action to support not only our immigrant communities, but the upholding of our fundamental values of family and community and inclusion that I think collectively as a community, as Americans, we believe and hold on to tightly.
When we witness dehumanization and can't figure out what thing is in our power to do, we ourselves end up being dehumanized. So I'm wondering if there are specific places where people can go to look and find out what they can do, what their small part could be. Where would you say they should look?
Sure, absolutely. So I would encourage everyone to go to our website, childrenspartnership.org. We have a number of different resources related to ways to get involved, at least here in California. But nationally, the Protecting Immigrant Families campaign is a tremendous opportunity of thousands of organizations nationwide that are coming together to basically support immigrant families and ensure that they're protected in today's environment, to ensure that children have access to the nutrition, housing, health services that they need to thrive, that eligible immigrants can participate in the public programs for which they qualify legally, and to ensure that we're creating these spaces that really do reflect who we are as a community. So protectingimmigrantfamilies.org is another area. I'm encouraged that people do want to learn and become involved. And I will say that if there is, one shining light of all of the difficulty of the last few years of this administration, is that many, many millions of people are motivated and are focused on making sure they're going to vote, and are focused on making sure they're using their voices. And this is at the local level, at the state level. You have more people running for office, more women of color running for office. And that's not accidental. It was people recognizing that what they were seeing at the federal level was not reflective of who they are, of who they believe our country is. And so I will accept that shining light for as long as we can, so that we can move forward federal policies that reflect our values, and that states and localities can continue to build on that so that we can create the inclusive society that we all want it to be.
So can we go back to Myra, the little girl? And what if, what if you were growing up now rather than the 70s? I mean, I almost hate to ask you that, but what do you think it would be like? And what would you want people to do to help you through growing up in this era?
If I was I don't even know. I mean, with all of this technology, I grew up in the 80s.
Oh,
I grew up in the
okay.
80s.
Yeah, I was wondering how you possibly could, but I thought you said.
But growing up today, there is so much information coming at children, and so much information coming at parents, and trying to figure out, there's a book for everything. There's a blog for everything. There's an article for everything. So I think I would be completely overwhelmed. But I do know that fundamentally, I would feel loved, and I would feel safe in my community. When we asked families in California where they felt safest, it was in their home. In their home is where they feel safest. Places of worship were up there, schools were up there, but in their home. And I think that speaks to the importance of family and connection as a protective factor, but also as information sharing. So many of our families, of our community members, of immigrant families rely on each other for information. And I think as a society, you actually see that more often than not. In healthcare, we know that women are often the central source of information for who's the best doctor to go to, or do you have a recommendation for X or Y? It's women that are that central source. Similarly, in immigrant families, women are critical leaders that provide support to families. And I think part of that is thinking about the home and the family setting that allows us to be protected. And I know that would be the case today. I also believe, as many of us do, I am where I'm at because nobody gets to where they're going alone. And not only my family, but mentors in my life, teachers, guidance counselors that supported me, mentors that I met along the way that helped mold me into who I am today. And I would hope that if I'm growing up in today's society, we still have the opportunity to do that, to look at kids today and serve as mentors and serve as the best examples that we can be as positive role models, so that they can feel supported and loved, even in the negative climate that so many are growing up in.
Well, now you are our shining light, Myra. Thank you so much for joining us. Thank you for joining us on Learning to Listen, Conversations for Change.
Thank you, Mayra. And here we are. And so much in the world has changed, and some of the things you've talked about have not only not changed, but gotten worse. And so I wondered if maybe we could start with an update on what's happened since we spoke in January with COVID-19 and the specific ways in which that, in the economic collapse that's gone with it, in the exclusion of people without documentation from federal supports like the CARES Act, and the great and very late white awakening to 400 years of racism, how all that's happened since we talked in January is affecting the kinds of families you and I were just talking about.
Mm-hmm. Definitely. First I want to say, Josh, thank you so much for the opportunity to join you. I'm just amazed at the community of people that you have with us today, and I'm honored to be in community with you and with everyone that's a part of this chat. I feel the sense of community here, and I'm really, really grateful to be with you. I have to say, it's just gotten worse for immigrant families, especially knowing that some of the hardest hit communities by COVID-19 are immigrant communities, because they are shouldering the front line and keeping our economy running. And this term essential worker gets thrown out a lot, and we value our essential healthcare workers and know the critical role that they play. But essential workers are also farm workers. They're also housekeeping and mechanics and food deliverers, grocery store workers, folks that are keeping our day-to-day lives operational, and that frankly are putting their own health and well-being on the line because they know no other way. They don't have the luxury. I truly feel grateful that I can work from home, right? I can continue to receive my paycheck and do my work from home. That is a luxury that I recognize. My mom is still taking care of an elderly gentleman, and still is doing that. My dad is still going to the valley to pick up fruits and vegetables, right? And that's my family, right? I know that there are millions of others that are doing the same. So it's that much harder. And when you look at the numbers, it reveals the truth. The numbers of people that are impacted by COVID-19 are Black and Brown families. They're disproportionately people of color, disproportionately immigrant communities. In the state of California, 75% of our COVID cases in children are Black and Brown children, Black and Latinx children. And that's only because their parents have to go to work. They don't have the opportunity to stay home. And I think an appreciation of all of us to recognize those contributions. So there's that. At the same time, there's been this national understanding, to your point, of racial injustice and what's happening, but also how racial injustice plays out in some of our institutions that many of us rely on for safety, like law enforcement. Looking at how policing is really a racist institution that has detrimentally impacted the lives of millions of Black people and people of color, and questioning the racism that exists in these institutions and how that also exists in other law enforcement agencies like Immigration Customs Enforcement. And I think that conversation and our ability to have that conversation has only happened because of the activities of the last 6 to 8 months, and because of the courage of thousands of people and communities and states that marched and made it known that we are not accepting this anymore, and that we're going to make a difference for our immigrant communities, our communities of color, our Black families, and really, again, move forward what we talked about, the values of what our country really is.
And maybe more specifically, I really appreciate your pointing out the term essential worker and what it really means. And essential work is so often done by people who immigrated here, so often done by people who do not have legal status here. But it also so often is work that has always been dangerous. Working in the fields in California means being sprayed by pesticides. And if you're pregnant, it means that your fetus's brain development is going to be at risk. Right. But now with COVID-19, essential work, so often again done by people from other countries without documentation here, also puts them at risk of being infected, and at the same time without access to the care that they need when they do get affected. So I guess I just want to ask if there's more to say about how COVID-19 is affecting families' pursuit of the healthcare that everybody needs. We know that the access and outcomes is disproportionately affecting Black and Brown people. But what are you seeing and hearing in California about people maybe avoiding getting tested because they are afraid of being detained and being deported? What kinds of things are happening because of those kinds of fears?
Absolutely. I think one, there is still a lot of fear and confusion around COVID-19, right? And making sure people know the necessary safety precautions that can be taken, but also recognizing that they can expect that of places that they go. And frankly, the employers have a responsibility to support their workforce in providing those protections. That isn't always happening, to your point, particularly for more marginalized occupations like farm workers. So we know that to be true. And we know that there's still an expectation for them to participate in the workforce. We also know that for many families, it's not possible right now to go to the doctor, not only because of the concerns that they may have with COVID-19, but frankly, we've all moved into this technology dependent society, even more than before COVID-19, where technology was bubbling up, right? But technology requires certain tools and resources. It means you need to have a laptop or a desktop or a smartphone or broadband internet. So the requirements or what families need today to fully support their child's well-being, their learning, their health is now necessary to have technology in ways that did not exist before. So we're hearing from our partners the challenges associated with that and making sure that we're also educating families and taking the time to inform them about what a Zoom call is, right? Or how to do telehealth with their provider if they have the opportunity to use broadband. And if not, what are alternatives? And it's frightening what we've seen as far as access to healthcare services for children. The Centers for Medicare and Medicaid Services put out some numbers just a few weeks ago that really showed the significant decline in primary care and time-sensitive preventive services for kids between March and May. There was 22% fewer vaccinations, so 1.7 million less vaccinations for kids up to age 2. We know how critical that time period was. 44% fewer child screening services that look at developmental screenings like detection of autism and developmental delays, even after for accounting for telehealth, and then 69% fewer dental services. So this is the general population. Layer on top of that, a family that may have concerns about immigration, layer on top of that, a family that has to still work a full work day. It's just piled on top of families. And it's why we are really pushing to have some sort of relief for families, all families, now in order to support whatever we can, families in these very, very difficult times.
So let's also look at the effects of the economic collapse. Although I do first want to point out, I'm really glad you brought up this issue of the digital divide and how it is a luxury for some of us to be able to work at home. While others don't have a smartphone or a laptop or broadband or internet. I just wanted to mention that we're actually doing a virtual service delivery webinar series. And in it, we're bringing together people from all over the country. We're crowdsourcing all kinds of workarounds for those kinds of challenges. So I invite everybody to tune in to those. But I also wanted to go back to your point about the luxury of working at home or not. If you are an essential worker and your work is outside of your home and you have children, then what do? If your childcare center or your school is shut down. Also, if you've lost your job, and as someone who's immigrated and who does not have legal papers, you don't have access to the CARES Act supports, what do you do to put food on the table or to pay your rent? So I want to hear a little bit about what you're hearing about those kinds of effects and what kinds of solutions, if any, you are hearing about in your work.
Definitely. So I think what we have heard from some of our community partners is that families make miracles, right? And I know this happens in all kinds of families, but they're stepping in and taking care of each other's kids, right? So if family has to work, they're dropping children off. Is that potentially putting families at risk because of COVID? Absolutely. But when you're saying a parent has to work, you find a way, right? So trying to figure out ways in which community networks are formed. And it's interesting because this is what immigrant families, what communities of color, what marginalized communities have done. They find a way, and finding these networks of care that exist when systems aren't serving their needs, aren't meeting their needs, are worse, are hurting them. So that anecdotally, that's what we've been hearing, is that families are stepping in and taking care of each other's kids. But I do have to give credit to states and communities that are stepping up and trying to fill gaps where the federal government is not doing its job. So you mentioned the CARES Act and its shortcoming of not giving mixed status families, immigrant communities, cash relief, the assistance that they need in order to support families during this very difficult economic times. The state of California, in partnership with private foundations, launched a disaster relief assistance for immigrants fund in order to provide $500 in resources for immigrant individuals in the state, for undocumented immigrants in the state, recognizing the contributions that undocumented immigrants make. It was a one-time deal, right? But it was something, and it was an important statement that recognizes the contributions of immigrants, recognizes that they're part of our communities, and again, validates their humanity and the dignity of who they are. And that is what the federal government is not doing by leaving out people who call this country home. And that, when we talk about who we need to support during this time, it is on all of us to ensure that we're doing what we can. COVID-19 isn't going to skip over a few people and hit someone else. It is a virus that is permeating every aspect of our lives, and as a result of that, all of us want to be healthy. That is how public health works. Obviously, there are some that don't believe in the fundamental science of public health, but for those states and localities that do, they are making efforts in order to ensure that immigrant families are receiving resources where possible. Is it enough? Of course not. Is the federal relief that was provided enough? No. It's more when people are losing their jobs and are still having to pay rent and still have to go, to the grocery store. It's not enough, but it is something. And I do want to give credit to states like California and others that have tried to move forward state resources in order to support them. And we need to do more.
Yeah, I was very impressed that in California, $75 million were put together somehow in the midst of this terrible, terrible budget crisis for families without documentation. And in our chat, you were valuing our really wonderful community. And you can see in the chat that people are doing the same thing you're just talking about. People are making suggestions about where there are, we can call it a positive deviance, where good things are happening. Here in Oregon, no evictions are enforced because of the COVID crisis. Here in Oregon, our field workers are helped in many ways, documented and undocumented. Here's another one. One simple way we can support immigrants is to call our state representative. And this is in Massachusetts with regard to a specific bill. Too many of us who are not threatened with loss of the roof over our heads in the midst of accelerating viral transmission have not thought about calling our legislators on behalf of these families. And I think that that gets to what you and I talked about a few weeks ago when you said, Josh, you scheduled this like a week before election. Yeah, sure did.
Yes.
So one thing I wanted to mention in the interview, when I asked you, what about these people who have all of these biases and assumptions that are so negative? And back in January, and you used the word white supremacy in a somewhat different context. And back in January, not as many people were talking about white supremacy as they are now, but you said it. But another thing that I think has changed is we're seeing lots of people change their political party affiliations, and a lot of people who voted one way and thought they would vote the same way this time have decided that they absolutely won't. So so we scheduled this a week before election, and I am curious to hear more about if you can think about other ways of having conversations with people who start out in a different place. Now, I know some people are not ready to hear it. And in our conversation, you focused on how this country was, has really been built on both the wisdom and knowledge of millennia of indigenous people, and on the immigrants who also built this country, and on the backs of slaves who were brought over against their will, right? So I'm wondering, in addition to pointing out the contributions of people who've immigrated, I have the sense that some of the hostility and the fear that is behind these biases and assumptions against people who've immigrated has to do with this belief in a zero-sum game, that there's not enough to go around for everyone. And I wondered, in the conversations that you have where that's the starting place, whether or not you find ways of sort of moving people past that. It's that fear of, it's a zero-sum game, there's not enough for everything to go around, and also that current minorities, are quickly going to be the new majorities.
Yeah, absolutely. I think that's the reality, right? The United States is incredibly diverse, and the growth in our child population is primarily driven by the children of immigrants. That is a reality. That is a fact. It is becoming more brown by the day, right? That is the fact of our country. And frankly, for those of us that are daughters or sons of immigrants or grandsons or great grandsons, we recognize and value that, and we appreciate that. But there are certain people who are holding on to an America that they see that frankly is not what we want it to become. And I should say, our country has a history of racism, a history of embedding white supremacy in its policies. And it's so funny, Josh. I remember during our conversation, when I said white supremacy, I said it because I knew it to be true, but I did hesitate because it wasn't as common. And today I am moved by the fact that there are so many conversations happening, not only in professional settings, but at the kitchen table about what white supremacy means. People automatically jump to the Ku Klux Klan, right? Or the Proud Boys. And that's not what we're talking about when it comes to white supremacy. We're talking about systems that were set up to benefit white people, to benefit a specific population, and to degrade others. That is something that is not necessarily only beneficial for people of color. It's beneficial to everyone if we dismantle systems like that are rooted in white supremacy. And it recognizes that we have a past to apologize for. We have a past to acknowledge that it isn't just happening in the summer of 2018 with family separation, that to your point, it happened with slavery and separating Black parents from their children. It happened when Indigenous children were sent away to boarding schools and separated from their families. It happened when Japanese American families were separated in internment camps. This country has a history of it, and it's time, way past time, to do something about it. And I'm grateful to the movement of people who have allowed this conversation to be where it's at, because it actually is very much connected to the immigration conversation and finding ways in which we can better treat immigrants as humans and as valued, contributors to our society. I mean, if you think about it, these were immigrants seeking asylum at the United States border that were separated from their children. And if that isn't something that just really sends a shockwave through you and makes you mad, then I don't know what will. And given that we are 6 days away from the election, I work for a C3. I will not tell people who to vote for, but I will tell you to vote for people who prioritize children, Vote for elected officials who consider the well-being of children in their policies and the decisions that they make to put forward policies, whether it's healthcare, education, immigration, economic policy. They all have implications on a child's well-being. Think about your elected officials and what they're standing for, and vote for those that put kids first.
Thank you, Myra. I'm also looking at the chat comments and seeing so much appreciation for you and for your work. So much sharing about resources and what we can do, as well as of the pain points. And maybe we've got one more minute. One last question would be trying to put together some of what we've been seeing in the chat. What do we need to do to come together so that immigration policy in the next 4 years is dramatically better than not just in the past 4 years, but in the past 12 or a couple of decades?
Yeah.
And it's a coming together part. I think that's part of the challenge.
I completely agree. And I think for many folks across the country, organizations that have been leading this work, the National Immigration Law Center, United We Dream, others, they've been at this for some time, right? They've been pushing to try to change the narrative of who immigrants are in our communities. And I'm feel rejuvenated by this uprising of people who care about these issues, similar to racial injustice and police violence, that there is this greater awareness and hopefully a recognition of the shared trauma of what we are doing to our children and how we can do better. And I'm hopeful that that's where we need to center, that our work for children, our work for immigrant families, it's not an isolated request. It doesn't belong to immigrant advocates. It doesn't belong to pediatricians or child advocates or public health researchers. It is work that we're going to do because it is all of ours. It is ours as a community. We can get this done because we are going to listen to what we've been hearing. We're going to pay attention to the responses to the public charge regulation. We're going to listen to marches that filled the streets when it came to family separation, but are continuing to fill the streets when it comes to racial injustice. The fight for racial justice is intertwined with the fight for health justice. It's intertwined with the fight for child justice. These are all interconnected issues, right? I've been thinking a lot about a quote by the great Audre Lorde. There is no thing as a single issue struggle because we do not live single issue lives. And the idea that we can all come together and recognize that your win is my win and my win is your win is what speaks to the power of voting. It's what speaks to the power of a committed group of people making change in our country. And it is what we're going to see over the next few weeks. I told you I'm an eternal optimist. I really am. One of my strengths finders, that's my top one on a strengths finder. My top one is positivity. And what you said was, well, you have to be, right, Myra? And I said, absolutely. There is no other way. And I will hold on to that and believe that we're going to make it happen for our kids and for all immigrant families as well.
Well, I'm so glad that that's where you landed, because that's what I wanted to thank you for, along with everything else, including all of your wisdom and information today and all the work you've done over the course of your professional life. I wanted to thank you for your optimism, because it's contagious. And whenever I'm with you, my hope is renewed. And I have a feeling you did that for many people who've joined us today. And folks who've joined us today have also renewed my optimism, because people are on the case here. And they're going to get together and make better things happen. So thank you so much, Myra Alvarez, for all of your work and for the work you'll continue to do, for your optimism and for the gift of your time and wisdom today. And thank you, everybody, for joining us. I hope you'll come back for our next Learning to Listen webinar, which is on November 18th at 3 p.m. Eastern Time, 12 noon Pacific Time. It's with my good friend Hassan Daniel, who is going to have a conversation with me on supporting fathers who experience sexual abuse as children. He will also join live for your questions. And we also have upcoming webinars. I mentioned this one on virtual service delivery. It's a series. The next one is on November 5th. That's next week. We have a series on supporting father involvement in co-parenting, and our third webinar in that series is on November 17th. And you can also find the recordings on our website, brazeltontouchpoints.org. Supporting everyone's mental health. Third webinar is on Monday, November 2nd, particularly sought after with what we're all going through in these very difficult times. And we may need it especially on Monday, November 2nd, when it airs again. And then there is our strengths-based family engagement. It's a 5-part series that starts up again on November 9th. So go to the brazeltontouchpoints.org website, go to the webinar tab, and you can find these and more. Again, thank you so much for being with us today and all you do for children and families everywhere. Bye. Bye, Mayra.